This podcast is produced by OnPod, a video content studio near you.
Welcome to the OnPod Expert Seat. We've got a great guest for you today, Fadji Koffi, or Dr. Fadji Koffi, I guess. She's a podiatrist, a very successful podiatrist, and welcome to the Expert Seat show.
Hi, nice to be here.
So when did you start in as a podiatrist?
I started as a podiatrist in 2013.
Okay.
So it's been about 13 years now.
Okay, wow. And where is your clinic located?
We're downtown, so on Chemin Côte des Neiges, just in front of Hôpital Général of Montreal.
Okay. Oh, wow. Excellent. How big is your clinic? How many, so I'm assuming it's not just you. How many other podiatrists or other disciplines do you have working in your clinic?
We're 4 podiatrists that works in the clinic. We have one podiatrist that takes care of the surgery. So
okay.
if you have a bone surgery like a hammer toe bunion, so he's the one that can take care of that for the clinic.
Wow. Amazing. So what other specialties does the clinic offer? Like what other services does the clinic offer?
We offer ultrasound, guided injection. We offer analyzing of the gait of the patient. Actually, we're going to move in a new office in May.
Mm-hmm.
And there we're going to have the x-ray. We're going to have shockwave, laser, everything that can be done in the podiatry. So it's going to be a really complete clinic as of May. But for now, we do, the only thing we don't have for now is really the x-ray.
Mm-hmm. So who are your typical clients? Who are they sent by doctors? Are they folks that are having troubles? Like who is your typical client?
For me, if you talk about me, I have clients from everywhere. I treat athletes, I treat children, elderlies, younger people. Mostly from doctors or other patients that will send me their patient because it's been a long time that I've been working. For the new podiatrists, I would say word of mouth and especially physiotherapists, medical doctors, everybody sends patients. We also have, we treat patients with diabetes that have ulcers because I studied in the wound care.
Mm-hmm.
So I actually work at the hospital of Joliette.
Oh, wow.
And I work with 4 other podiatrists there. So we serve the people from everywhere at that hospital. So it's a project that we have because I teach. So with that, we're able to see patients that are covered by RAMQ. So, and we treat patients with the wounds. So in my clinic, I'm able to treat those type of patients too.
Wow. So what are things, like for the sake of folks maybe that are maybe, what are things that people should be looking for? Or, because I know podiatry is probably one of those things that people don't think about very much, and maybe they ignore things that they should be paying more attention to. What are some of the typical things that people should know about as far as taking care of their feet?
Yeah, most people don't take care of their feet unless the feet is talking to them.
Yeah, and it's usually too late at that point, right?
Yes, most of the time, people will wait. That is very obvious before they come. So if we talk about having a fungus, which a lot of people have, people will come not when they start seeing signs of the fungus. They will come when everybody else is seeing signs of the fungus. And most of the time it would be like, oh, my wife told me that I should come, or my friend saw my toe and she said, you should get that checked. So I would say that everybody should check their feet. And if you think about your feet, then you should see a podiatrist probably. Because if you have sometimes if we talk about plantar fasciitis, which is having pain in your heel, sometimes you will feel that pain and you'll be like, oh, I'm able to continue. I'm just going to continue. And at one point you will wake up in the morning and you'll be like, oh, I can't walk. And we see people with that type of pain. Sometimes you could have a stress fracture. I'm talking about the runners. They run, and then the bone is broken, but they're so used to running and having
with the pain,
that they're not aware of that pain, and then they will come when they cannot run anymore. So I would say if you do a lot of sports, if you use your feet a lot, if you have discomfort, you should go and just check to see if everything is okay. And if everything is okay, it's fine. And sometimes we can give you some advice for the pain not to come again. So that's what I would tell patients. Just look at your feet and don't ignore them, because you need them for all your life.
So what do you think are some of the reasons why people don't go see a podiatrist? I mean, because I think people need to know that. Like, why don't they come? Like, what are some of the excuses, or what are some of the reasons why you think people don't take the time to see a podiatrist?
I would say sometimes it's a shame. Sometimes they would think that it's not very important to see the podiatrist because it's not a matter of life or death for most people. So they won't pay attention to it. You see, like if I make the parallel with the dentist, which has almost the same type of practice than the podiatrists have, if you have a toothache, you will go see your dentist because you need to eat.
Yeah.
So, but if you have foot pain, you can manage elsewhere. So I think that that's why people will tend to push it further down.
Right. Yeah. And that makes perfect sense. Like I know in a lot of other types of medicine, I don't know much about podiatry. So other situations are signs of a deeper problem or another problem. Does that exist in podiatry as well, where you might have a problem with your foot, but it's a symptom of a larger problem that could be more threatening to your health?
Sometimes you can have symptoms in your foot, and then you would have to see your family doctor because it has to do with something that's not going on well in your system. So we work in collaboration with the family doctors most of the time. Sometimes we will refer the patient to the family doctor to make sure that they get the proper test done, to make sure that everything is okay. So yeah, there's some condition where you need to see your family doctor, and we work with the family doctor in that sense.
Yeah, absolutely. So you talked about dentistry. What is the relationship between RAMQ and private care right now? Is like, I guess a lot of people might be shying away from seeing a podiatrist because they don't know how much it costs. So what is the situation right now as far as that's concerned in Quebec?
The podiatrists are not covered by RAMQ. It's really like the dentist, the physio. So we work in private clinics. So yeah, probably that it could be one of the reasons that patients don't go see the podiatrist. Sadly, this is one of the reasons too. But for that, I would say in my case, in my business, we have a part of the business where we're working this year to make sure that we can serve the people that don't have money, and that can be covered by the foundation that we're creating to see those type of patients.
And if I'm not mistaken, because I have worked with physiotherapy clinics in the past, I would imagine that it's covered by a lot of insurance.
Yes, it is covered by insurance, but you have to have an insurance. So some people don't have, but most insurance will cover the cost of podiatry. And the thing is, some people don't even know that their insurance covered them. So the first thing is, if you have insurance, check to see if your insurance is covering. And if you have to take insurance, maybe you should check to see if the service will be covered.
Right. And I'm sure it's as easy as calling your office and giving your insurance company or giving your insurance policy, and you could look it up, I would imagine, right?
No, we don't have that type of service in podiatry. I know dentistry have that, so they're linked with the insurance, but in podiatry, no, we don't. So usually it's the patient that have to check for his insurance to make sure that it's covered.
Okay. That's a shame. It should be, I would say. Okay. But yeah, I think it's really important that people understand that symptoms in your feet can be a signal of something else that's happening. I know with elderly folks, it's something to care for. Maybe talk to us a little bit about, like, if I'm looking after an elderly family member, what thing should I be thinking about, or what thing should I be looking for that say, hey, maybe I better bring grandma or grandpa to see a podiatrist?
What I see most of the time is the nails are really long, and sometimes it will create a wound on the other toe.
Ooh.
Because the nail will grow, and then instead of growing straight, it will be crooked a little because of the socks. So, and sometimes you could have a hammer toe, and the shoe will rub against the toe and then create a wound. And sometimes people will self-treat, and they will go to the pharmacy to get those pads, and then they will put it on. But the thing is, when you're elderly, sometimes your vascular system is not working well. So then you will create a wound. And then people will come to us with the wound. But if they came with the callus before the wound, then we will treat the callus and then we wouldn't have a wound. So I would say if you have an elderly that you're taking care of and you see calluses, redness, or something that will create a wound, then you should come to make sure that that is checked. And we will check the vascular system to make sure that the blood is flowing well before we even treat the patient.
Wow.
So sometimes even ingrown toenails, fungus. And the thing with fungus is that at some point it will make the nail so thick that the pressure hurts the patient.
Wow.
So in that case, then we have to trim the nail, and then we can maybe talk about the treatment for the fungus. So all those things. And the moisture between the toes with elderlies that are in socks or in slippers all day long. So sometimes you can develop bacteria in between or fungus in between the toes. So those are the things that we see most of the time.
I think you hit on a really interesting point. I think a lot of people believe that they can solve these problems with over-the-counter medications. Maybe talk to us a little bit about like when that's okay, but when that's not enough.
If you don't know your condition, if you don't know your health, if you don't know if your vascular system is well, then you shouldn't treat yourself with the product that will burn your skin and create wounds. I would say that. So it's good to have an overall view of your system, especially if you have diabetes or other pathology that affect the foot. People that don't feel their feet. Sometimes you will have a corn under your foot, and then if you ignore it, sometimes it could create a ulcer. And we see the patient sometimes too late because they come with the ulcer already. But if we saw them before, then we would maybe prevent it with a good shoe wear or maybe modification in the shoe. I would give an example. I have a patient that I saw a few weeks ago. She has a corn on the top of her second toe, but she likes to wear narrow shoes. So what I offered is to put something to stretch the leather of the top of her shoe instead of her toe doing it. Then we do it in advance. So all those tricks, sometimes it's good to have. And then the goal is not to see the patient every week. It's not a abonnement. I don't know.
It's not a membership.
It's not a membership to the clinic. It's you come, we give you the advice, we see the overall. When I see the patient, usually I will do overall 360, make sure that I give all the info so the patient can be autonomous and go with those infos.
Right.
So that's how I work usually.
Yeah. So it's great because I was going to lead me into my next question was like, how often should someone see their podiatrist? Is it like just a regular doctor, like once a year or every couple of years? Like obviously I imagine when you're older, it should be more often, but let's say someone who's middle-aged, what frequency should they be seeing their podiatrist?
If you're middle-aged and you don't have any issues, no pain, nothing, you don't really need to see the podiatrist. Okay. But if you have foot pain, toe pain, ingrown toenails, or something that's bothering you in your foot, then you should see once, and then the podiatrist will see with you how often he or she should see you. Because it's really one-on-one thing. Like there's no. Yeah,
you don't go see. Well, you do go see a dentist to get your teeth clean.
Yes,
but it's not really the same thing as far as a podiatrist.
No, it's not. It's really like elderly because sometimes they cannot bend to cut the knee, the toe and all. So the toenail. Then we have to do it for them and help them with that matter.
And of course, when you have diabetes, it's even more critical that it's done professionally, right?
Yeah, exactly. So if you have diabetes, with the chart, you could be seeing your podiatrist every year, every 2 months, every 3 months, depending on your condition.
Right. Well, amazing. So, okay. So where's your clinic now? Like you said, Côte des Neiges?
Yes. It's on Côte des Neiges, near Guy Concordia.
Okay.
And near the General Hospital of Montreal.
And you're moving when?
We're moving in the same building. It is
in the same building. Okay.
Yes, it's a Seaford building. Okay. Yeah. We're going to be at the top on the 7th floor.
All right. Wonderful. Well, Dr. Fadji Koffi, thank you so much for being on the Expert Seat podcast. I hope that people got a lot of good information out of this. I think that you're doing wonderful work, and we'd love to hear more about your foundation.
Okay, now?
No, not now, but
Okay, yeah. Okay.
All right. Thank
Later
you.
on. Thank you.